Inflammation. Definition. Inflammation is a local response or reaction of living vascularized tissues to endogenous and exogenous stimuli. The term is derived from the Latin word, inflammare, meaning to burn. Inflammation is fundamentally destined to localize and eliminate the causative agent and to limit tissue injury. Thus, inflammation is a physiologic protective response to injury. Inflammation is itself not to be considered as a disease. What are the causes of inflammation? Causes of inflammation are apparently causes of diseases such as 1. Physical agents, for example mechanical injuries, alteration in temperatures and pressure, radiation injuries. 2. Chemical agents, including the increasing lists of drugs and toxins. 3. Biologic agents, which are infectious, for example bacteria, viruses, fungi, parasites. 4. Immunologic disorders such as hypersensitivity reactions, autoimmunity, immunodeficiency states, etc. 5. Genetic or metabolic disorders, for example gout, diabetes mellitus, etc. Here are the examples of diseases with specific inflammation: syphilis, tuberculosis, leprosy, glanders, scleroma. Let us look at the nomenclature of inflammation. The nomenclatures of inflammatory lesion are usually indicated by the suffix -itis. Thus, inflammation of the appendix is called appendicitis and inflammation of meninges as meningitis, etc. However, like any rule, it has its own exceptions, examples pneumonia, typhoid fever, etc. Classification of inflammation. Inflammation is classified based on duration of the lesion and histologic appearances into acute and chronic inflammation. 1. Classification according to the course. Acute, subacute, chronic. Classification according to the predominant phase. Alterative, exudative, proliferative, productive. Classification according to the causative factors. Trivial, specific. Let us discuss briefly about acute inflammation. Acute inflammation is an immediate and early response to an injurious agent, and it is relatively of short duration, lasting for minutes, several hours or few days. It is characterized by exudation of fluids and plasma proteins and the emigration of predominantly neutrophilic leukocytes to the site of injury. The 5 cardinal signs of acute inflammation are: 1. Redness, which is due to dilation of small blood vessels within damaged tissue as it occurs in cellulitis. 2. Heat, which results from increased blood flow, or hyperemia, due to regional vascular dilation. 3. Swelling, which is due to accumulation of fluid in the extravascular space, which, in turn, is due to increased vascular permeability. 4. Pain, which partly results from the stretching and destruction of tissues due to inflammatory edema and in part from pus under pressure, as abscess cavity. Some chemicals of acute inflammation, including bradykinins, prostaglandins and serotonin, are also known to induce pain. 5. Loss of function. The inflamed area is inhibited by pain, while severe swelling may also physically immobilize the tissue. These are the events of acute inflammation. Acute inflammation is categorized into an early vascular and a late cellular responses. 1. The vascular response has the following steps. A. Immediate, or momentary, vasoconstriction in seconds due to neurogenic or chemical stimuli. B. Vasodilatation of arterioles and venules resulting in increased blood flow. C. After the phase of increased blood flow, there is a slowing of blood flow and stasis due to increased vascular permeability that is most remarkably seen in the post-capillary venules. The increased vascular permeability oozes protein-rich fluid into extravascular tissues. Due to this, the already dilated blood vessels are now packed with red blood cells, resulting in stasis. The protein-rich fluid, which is now found in the extravascular space, is called exudate. The presence of the exudates clinically appears as swelling. Chemical mediators mediate the vascular events of acute inflammation. 2. Cellular response. The cellular response has the following stages. A. Migration, rolling, pavementing and adhesion of leukocytes. B. Transmigration of leukocytes. C. Chemotaxis. D. Phagocytosis. Normally blood cells, particularly erythrocytes in venules, are confined to the central, axial, zone, and plasma assumes the peripheral zone. As a result of increased vascular permeability, more and more neutrophils accumulate along the endothelial surfaces, peripheral zone.